UroPatient. Tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning and welcome to UroPatient. I'm Vic Senese, registered nurse, urology educator, and host of UroPatient. It's a cold one out here today. Let us know if you're experiencing some cold weather in the comments. Comments are open, so feel free to put anything in there that you'd like. Hey, and don't forget to help us out by liking and subscribing to the show. So as I said, today I'm talking about something every man experiences, but not nearly enough men understand: how an erection actually works. So whether you're dealing with erectile dysfunction, changes as you age, or just curious about what's going on behind the scenes, this video is going to be for you. So today we're going to break it down in clear, simple terms about how the brain, nerves, and blood vessels, and even hormones all work together to make an erection happen, and what can interfere with that process. No myths, no embarrassment, just real information you can use to better understand your body and have more informed conversations with your healthcare provider. So let's get started with how an erection works and what every man should know. Welcome, everyone. So today we're going to talk about how erections actually work. This is normal anatomy and physiology, but it's something many men were never clearly taught. So I like to start by saying this isn't just about sex. Erections are closely tied to blood flow, nerves, and hormones. Understanding this helps men recognize when something could be wrong. So the penis has three main chambers: the two corporal cavernosa, which are these things that you see here. Those are these tubes that run along the side of the penis. Those are what are act like sponges that fill with blood. Now underneath here, that's the urethra, which carries urine or semen. So basically, those are the parts that are necessary for an erection. You need to fill those chambers with blood. There's no bone involved. It's basically filling up the penis with blood and trapping it. But let's start with the brain, because that's where the erection starts. It doesn't start with the penis. Now, thoughts, touch, or visual cues send signals down the spinal cord to the pelvic nerves, the nerves that are by the penis. That means anything that disrupts this signal, that's important, can affect erections. What can cause those disruptions? Well, diabetes is one of the most frequent causes. Because of the high blood sugar over time, it harms the nerves throughout the body, including the ones that go to the penis that are responsible for causing an erection. Many patients that are diabetic, they start getting some numbness in their feet, maybe even some of the nerves that affect their vision, etc. They don't always realize that the ones that go to the penis get involved too. Now, diseases like multiple sclerosis, which attacks the central nervous system, can interfere with those nerve pathways. Diseases like Parkinson's that affect brain signals and dopamine levels can play a role in causing sexual dysfunction. Anybody with a spinal cord injury, even sometimes just spinal trauma, maybe you've had surgery on your back, things that injure those nerves can make it hard or impossible for those erectile signals to reach the penis. Other issues that we don't always think about are something like a stroke. Chronic heavy alcohol use. Over years, it can cause damage to nerves. And certain pelvic surgeries. Maybe you had a prostate removed. Those nerves that go to cause the erections run right along the prostate. So if they were accidentally injured, it can cause sexual dysfunction or erection dysfunction. And I think it's pretty clear that there's a lot of ways that signal can get disrupted. So remember, erections start by a nerve signal. Now, what the nerve actually does is cause something called nitric oxide to be released. That's the key chemical here. It tells the smooth muscle in the blood vessels to relax, allowing more blood to flow into the penis. When a man becomes sexually aroused, the brain sends a signal down the nerves to the penis, triggering those special cells in the wall of the penile arteries and the spongy erectile tissue called the corporal cavernosa that we talked about to release nitric oxide. This nitric oxide acts like a signal to relax and widen, dilate those vessels so that the smooth muscle in the vessels opens up, allowing a large rush of blood to flow into the penis and fill the erectile chambers. At the same time, nitrous oxide helps trap that blood inside by relaxing muscles that would otherwise let it drain out quickly. So as it relaxes and expands, it also compresses those veins. Many common treatments for ED like Viagra, Cialis, etc. work by boosting the effects of nitric oxide, making it easier for the natural process to happen even when things aren't perfect. So they prevent nitric oxide from getting broken down. They're not nitric oxide, but they are what we call PDE5 inhibitors. PDE5 is the chemical that gets rid of the nitric oxide. Otherwise, we'd be walking around with erections all the time. Too much of that makes it harder to get an erection. Hopefully that's kind of clear. Took me a while to figure all that stuff out. All right, so let's dive a little deeper because this is really kind of interesting. It's really a blood flow and trapping system. So an erection happens when blood flows into the penis. It increases when we get sexually stimulated and becomes trapped there. That's the key. Normally when a man is sexually aroused, nerves in the penis signal those blood vessels to relax and widen, like I talked about, allowing more blood to rush into those two chambers called the corporal cavernosum. Now, as these chambers fill, the pressure inside rises and it compresses. And you can see from that picture over here, over there, those veins are along the side. And as the expansion of the artery takes place, it starts putting pressure on that. I always say it's kind of like stepping on a hose. If you step on a hose, you're going to trap the water. It won't come out. Take your foot off the hose, the water flows. So some men experience an erection that they can see the penis is getting hard, but it doesn't quite lock in. That locking in effect where the penis stays hard is trapping from the veins. Anything that prevents those veins from trapping the blood is going to make the penis not get fully hard and stay hard. So very important. Blood has to flow in, but less flows out. Now, it doesn't stop all blood flow, but if it stops enough of it so that it's overcoming the amount that's going in. So it's filling it faster than it's coming out. Whoopie doopie, we get an erection that way. And it's also how we get rid of the erection, because once that effect reverses, of course, then the blood starts to flow out through those veins and it goes back to its flaccid state. So I always like to say, my analogy is think of an erection like filling a balloon and then tying it off. If blood can't get in or leaks out too quickly, the firmness will be lost. So if you let go of the balloon, the erection goes away. I know it's kind of simplistic, but I always say if the balloon had a hole in it, you could blow it into and it'll fill, but it's going to keep going down. Again, it's got to be trapped. So that's kind of my analogy for how the erections work. Now, do hormones matter? Well, testosterone doesn't directly cause erections. Men who have very low testosterone can still get erections, but it does support your desire to have sex and some of these chemical pathways that are involved. So low testosterone can make erections harder to achieve because, again, those pathways are not working quite as well when you're not sexually turned on by the effect of testosterone. Now, the erectile dysfunction is often an early warning sign of vascular disease. So if you're a smoker, your risk of having an erection problem, call impotence, is increased because of that. And why is that? So let's dive into that a little bit. The arteries in the heart that get blocked, that cause a heart attack, are much, much bigger than the arteries that go to the penis that cause an erection. So you can imagine if you're getting enough blockage to affect your heart, how much blockage is hitting the penis first. We actually use that almost as a signal for why you should be examined for cardiac disease. If somebody comes in with erectile dysfunction, they can't get an erection, that should be a referral to make sure that we are checking their heart, because this could be an early warning sign. Really important. There's another thing. We did talk about how the erections are caused by the brain. So, mental health can also play a major role. There's something called performance anxiety, meaning that, a guy tries to have sex, but has a failure for some reason. Now, always in the back of his mind is that I might fail, I might fail. That effect alone could be something that could cause difficulty in an erection. Interestingly, they used to send these patients off for psychotherapy to try to get over that performance anxiety, but a little shot of a medicine that goes into the penis that causes that dilation without the effects of all the other stuff. You don't need potent nerves in there. You don't need all that other stuff we've been talking about. This will work directly. A little shot into the penis of a chemical that'll cause an erection will give you an erection. And we've been really successful in getting patients over performance anxiety because we teach them how to inject themselves. They get the erections, and then after a while, they realize they don't need it. It's been a game changer. So all those things do affect erections. The big takeaway is that erections can reflect your overall health. If problems persist, it's important to talk to a healthcare professional. Well, I hope this helped you understand a little bit more about erections. All right. So remember, if you're having trouble with getting an erection, it's not just a normal part of aging, and it's something that we can correct for you. So be sure to see your healthcare provider for more information on that. Hopefully, this gave you some good education and things to talk about with your healthcare provider. Hey, are you struggling to pee? Waking up all night? Feeling like your bladder never fully empties? Well, join us next week on UroPatient. I'm talking about a lesser known option for men with urinary blockage from an enlarged prostate, something called prostate stents. And actually had somebody write in about this and wanted to know more about them. So what are they? Who are they for? Do they really work? And what are the downsides? I'll break it all down on how prostate stents work, when they're used, and who should not get one, and how they compare to other BPH treatments. No hype, just facts men need before considering this option. So join me next week for Stenting a Blocked Prostate, what men need to know about prostate stents, because remember, better information leads to better decisions. See everybody next week on UroPatient.com.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, baby, your help for you and me. Knowledge is power. We make it clear every Saturday morning. The podcast is here.